Today's topic, polio. Polio, also known as poliomyelitis, is a highly contagious disease caused by a virus that attacks the nervous system. Children younger than 5 years old are more likely to contract the virus than any other group. According to the World Health Organization, WHO, 1 in 200 polio infections will result in permanent paralysis. However, thanks to the Global Polio Eradication Initiative in 1988, the following regions are now certified polio-free: Americas, Europe, Western Pacific, Southeast Asia. The polio vaccine was developed in 1953 and made available in 1957. Since then, cases of polio have dropped in United States. What are the symptoms of polio? It's estimated that 95 to 99% of people who contract polio virus are asymptomatic. This is known as subclinical polio. Even without symptoms, people infected with polio virus can still spread the virus and cause infection in others. Non-paralytic polio. Signs and symptoms of non-paralytic polio can last from 1 to 10 days. These signs and symptoms can be flu-like and can include fever, sore throat, headache, vomiting, fatigue, meningitis. Non-paralytic polio is also known as abortive polio. Paralytic polio. About 1% of polio cases can develop into paralytic polio. Paralytic polio leads to paralysis in the spinal cord, spinal polio, brainstem, bulbar polio, or both, bulbospinal polio. Initial symptoms are similar to non-paralytic polio. But after a week, more severe symptoms will appear. These symptoms include loss of reflexes, severe spasms and muscle pain, loose and floppy limbs, sometimes on just one side of the body, sudden paralysis, temporary or permanent, deformed limbs, especially the hips, ankles, and feet. Post-polio syndrome. It's possible for polio to return even after you've recovered. This can occur after 15 to 40 years. Common symptoms of post-polio syndrome, PPS, are continuing muscle and joint weakness, muscle pain that gets worse, becoming easily exhausted or fatigued, muscle wasting, also called muscle atrophy, trouble breathing and swallowing, sleep apnea, or sleep-related breathing problems, low tolerance of cold temperatures, new onset of weakness in previously uninvolved muscles, depression, trouble with concentration and memory.